Welcome to today's episode of the Healthcare Security Brief Podcast, where we explore the current state and future of cybersecurity and partnerships that make a real difference for healthcare organizations. Today, we're excited to have two fantastic guests from IBM Security. We have Salwa Rafee, Managing Partner, Author, and Cybersecurity Practice Lead, and Dr. Bonnie Netschert, Program Lead for Cybersecurity and the Global Security Partnership with Microsoft. IBM is a global leader in cybersecurity, offering a range of services and initiatives aimed at enhancing security resilience, workforce development, and addressing modern cyber threats. In today's discussion with Saul and Bonnie, we dig into topics such as healthcare security shifts in the last couple of years and why that inspired Salwa to write a new book about this important topic, how stakes have shifted from data breaches to patient safety events, where rapid change in healthcare organizations are often trying to solve tomorrow's security challenges with yesterday's tools and operating models. How regulation is a huge factor in healthcare. How can organizations move from treating HIPAA and other mandates as a checkbox exercise to using compliance as code and automation and much more? We dive in pretty deep with this discussion with Sal and Bonnie and have broken up this episode with IBM into two separate parts. So make sure to check out the second part of this episode as well, where we continue the discussion. So with that, let's jump into part one of my conversation with Sal and Bonnie. Warm welcome to you both. Thank you for your time, and let's jump in. To set the stage, what are the biggest shifts that you're kind of seeing in the healthcare security space over the past couple of years? And more specifically for Salwa, why did you feel compelled to write a book about it now?
Thank you. Thank you very much, Greg, for the opportunity to be with you today. Over the past few years, healthcare has gone through a profound digital transformation. I'll give you a few examples. EMRs are pervasive. Care is moving outside the four walls of the hospital, and clinical data is following and flowing between payers, providers, and pharmaceuticals at a scale that we haven't seen before. At the same time, adversaries have realized that hospitals are high value, high pressure targets. If you can disrupt clinical workflows, you create leverage and everybody's listening to you. And that's exactly what we have been seeing with modern ransomware and extortion campaigns. Frankly, I felt compelled to write my book now because the stakes have shifted from data breaches to patient safety events. And many organizations are still trying to solve tomorrow's problems with yesterday's tools and operating models.
Thanks, Saul. It's definitely a huge paradigm shift that we're experiencing and seeing. Healthcare is also very unique compared to other industries. So, what makes protecting hospitals, payers, and life sciences environments fundamentally different from securing other typical environments, enterprise related?
I'm not exaggerating when I say that healthcare is different because the business outcome is not just financial performance or uptime, it is patient care, safety, and trust. In most hospitals, you have a unique mix of legacy systems, highly specialized clinical workflows, and life critical devices that can't simply be patched or rebooted on demand, all running on thin margins and under heavy regulatory rules. Unlike other industries, you're constantly balancing clinical usability with security, balancing access versus privacy. If your security controls get in the way of a physician or a nurse at the point of care, you haven't solved the problem. You've just moved the risk somewhere else. That blend of clinical, operational, and regulatory complexity is what makes healthcare security so challenging and so important.
Thanks. I couldn't agree more. Spot on, especially that shift and somewhat that tendency to kind of push or kick those problems down to different areas. You mentioned ransomware, right? And that has dominated the headlines in healthcare specifically and continues to do so. How do you think, how are the attackers evolving? And what are some of the real world impacts you've seen on patient care and clinical operations?
Ransomware in healthcare has evolved dramatically from opportunistic spray and pray campaigns into highly targeted multi stage operations that behave now more like business takeovers. We are seeing now attackers don't just encrypt a few file shares, they move laterally, gain control over domain infrastructure, and deliberately disrupt EMRs, imaging systems, and even ancillary services that keep a hospital running. The real world impacts, and you're asking about that, Greg, these are stark. We are seeing delays or divergence in emergency care, postponed surgeries, manual workarounds that increase the risk of clinical errors and staff burnout. I was recently talking to a nurse who's lived through a cyber incident. They don't describe it in terms of CVEs and indicators of compromise. They talk about patients they couldn't see, treatments they had to delay, and the emotional toll of not being able to deliver the standard of care they are trained for.
Thanks, and couldn't agree more. We hear a lot about that, where these consistent stressors or pressures are really being experienced throughout the care continuum, throughout that clinical team for sure. With that, we talk a lot about zero trust, right? And so, for a healthcare system CIO or CISO that might be listening today, what does zero trust practically look like in a hospital or integrated delivery network?
In practical terms, zero trust sometimes give kind of a contradictory meaning in a healthcare setting. It means moving away from the implicit trust created by a safe internal network in healthcare and toward explicit continuous verification for every user, every device, and workload. For a CIO or a CISO, that looks like a strong identity and access management with MFA, least privilege roles assigned to clinical and admin workflows, and network segmentation that keeps medical devices, guest networks, and cloud workloads from freely talking to each other. It also means investing in visibility and telemetry so that you can evaluate trust dynamically. Are clinicians accessing systems from expected locations? Are devices behaving normally? Are service accounts being abused? Zero trust done right should enhance resilience without making day to day experience unbearable for clinicians.
Thanks. And I think that's a really excellent point, right? That notion of burden upon the clinician. It's a large, sizable obstacle, and we constantly hear about what are tactics and maybe best practices to avoid that or even reduce that burden. A question for Bonnie. I know we've talked a little bit about this in the past, but medical devices are notoriously hard to secure, right? How should organizations think about segmenting, monitoring, managing these assets without disrupting clinicians?
Great question, Greg, and very timely. I recently published a blog on this very topic, which can be found on the IBM.com site. But to answer your question, it's tricky because medical devices and the broader Internet of Medical Things, IOMT, are clinically essential, but often run on outdated operating systems and may not even support frequent patching or traditional agents. But the first step, though, is always visibility by building and maintaining an accurate inventory that knows the differences, say, between an infusion pump and a smart TV in a waiting room. We then typically move into network segmentation, grouping devices into logical zones. And the key with all of this, though, is close collaboration with biomedical engineering so that security controls are designed around actual clinical workflows.
Great feedback, Bonnie. And I think that's important to note, right? Designing specifically around those clinical workflows as opposed to maybe taking another example and trying to fit it into that unique space. So much complexity going on in this healthcare space. And to your point, really anchoring that design thought process up front definitely makes a sizable impact for sure. Um, with that, we talked about the complexity of all these devices and managing that. We've seen a lot in this past year with cloud, AI, digital front doors, which are transforming the patient experience on the patient side. What new risks do those innovations introduce, and how do security teams get that balance right of enabling the innovation instead of blocking it and prohibiting?
Um, I can take this question, Greg. And, we talk about cloud AI and digital front doors, such as telemedicine platforms, patient portals, and remote monitoring. These are open tremendous opportunities to improve access and personalized care. But they also expand the attack surface. Data is now dispersed across multiple cloud providers, SaaS applications, third party ecosystems, and the AI models are introducing new concerns we never had before. These around data governance, model integrity, and explainability. And also, this is the time where security teams can enable innovation by embedding themselves early in all digital initiatives, defining secure reference architectures for cloud AI, and providing reusable guardrails for automated policy checks. Instead of being the team that always says no, which is probably you would see that people think security teams always say no, these security functions become the team that says yes, and here is how we can do it safely at scale.
I think that's an important point that you bring up too about scale, right? Whether it's a small rural hospital organization or it's a large IDN, scalability is certainly an important component. And to your point, it's really interesting to see the security team kind of push to the front, almost the tip of the spear for saying yes, but also solving some really important problems and challenges for the organization.